Okay, welcome everybody. This is the Japanese Mutual Aid Society seminar on Medicare. And this is the third in the series that we've sponsored so far in conjunction with the JASC. For those of you who don't know, the Japanese Mutual Aid Society was formed in 1935. And it's the oldest Japanese American organization in the Chicago area. We are a nonprofit organization. The primary purpose is to administer the care of the cemetery sites and mausoleum for the Japanese American group at Montrose Cemetery. The purpose of the Japanese Mutual Aid Society is also to help community organizations at large, and part of that is to sponsor seminars like this to inform the public about what is available as a senior. So I'm going to introduce now Justine Rebickus from the JASC.
Thank you. So my name is Justine Rebickus. I'm the Program and Operations Manager at JASC, which is the Japanese American Service Committee. And I just wanted, for those of you who don't know, quickly tell you a little bit about our community organization. So there's kind of three areas that JASC focuses on. The first one is really the service area. We have several senior services programs. We have an on-site adult daycare that meets Monday through Friday, supervised by nurses, and it's really an interactive way for seniors to be in community with other seniors and stay active. They do exercises, they do art projects, they go on field trips. Today they went to a casino. And we also have in-home care for either long-term or temporary people who might need help in their homes. And we have a social worker on staff as well who runs a weekly group for active seniors and also meets with private clients privately. On the cultural side of it, we have different classes, cooking classes, art classes, language classes. We have a bilingual children's program, just lots of different exciting things going on there. And then finally is our Legacy Center, which is an archive and history of Japanese Americans, specifically a lot of information on in Chicago. An exciting project that we're working on right now is pretty soon coming in the end of June. We've partnered with the Alphawood Gallery, which is located on like Halsted, Lincoln, Fullerton intersection. Will be an exhibit coming up soon. So if you don't get our emails, I'll be adding people who signed in here to that list, but that should be a project that will last at least into December, if not longer. It's still coming together and will be in multiple phases. The title is Then They Came for Me, and really talking about the incarceration and how we can learn from our history, as well as just sharing that history with a wider community. So if you have any other questions about JSC, please talk to me. We're really happy to partner with the Mutual Aid Society in offering these programs. And I'm passing it to Brian.
Thank you very much. My name is Brian Frenay. I'm one of the directors of the Mutual Aid Society of Chicago, and I'd like to thank you all for coming out for what is the third in our series of seminars for the primarily the senior community. Tonight we are going to have a presentation on Medicare, and hopefully our next seminar is going to be scheduled for, and we'll discuss Social Security benefits, and after that some tax planning. But tonight is Medicare, and I am privileged to introduce our speaker tonight. For many of you know him, he is Kerry Wong. He is a certified financial planner. He has been employed with Prudential Financial for over 30 years. He is listed in the National Association of Insurance and Financial Advisors. He is a chartered life underwriter, a chartered financial consultant. a certified financial planner and a registered insurance advisor, so he knows what he's talking about. He is going to speak to us on Medicare benefits, on things that you need to know as you navigate through Medicare, because it is a difficult area, and we hope that you find his presentation to be informative and enjoyable. So without any more delays, I'd like to introduce Carrie. Thank you, Carrie.
Good evening. It's nice to see a lot of familiar faces here tonight. Just a couple housekeeping items. If you could silence your phones. And if you need to use the washroom, you just need to go out in the main area, go down the hallway toward the crystal trophy and to your right. And the washrooms will be on your right. Okay? We'll be discussing Medicare, and there's a lot of moving parts. The kits that you have, and I've noticed a lot of you have already gone through them. There is redundant information, but this presentation will break down all the parts of Medicare. A lot of you don't know, but Medicare was first proposed in 1945 by President Truman. It took a full 20 years until it was signed into law by President Johnson under the Great Society program. In 1997, Medicare Plus Choice Plans started with the Balanced Budget Act. And in 2003, the Medicare Modernization Act under President Bush was signed and changed Medicare Plus Choice to Medicare Advantage plans, added prescription drug benefits, and in 2006, Part D became a rollout for availability for all Americans. Who's eligible? Medicare is health insurance for persons 65 or older, people who are deemed disabled by Social Security for 25 months. And after 25 months, you're automatically eligible and put on Parts A and B. The Centers for Medicare and Medicaid Studies governs the actions of Medicare, Medicaid, Medicare Advantage plans, Part D programs, and the Children's Health Insurance Program. All marketing materials, information, brochures have to be cleared by CMS before they're distributed to the public. And their focus is to protect everybody who is eligible for Medicare, Medicaid, and any of the other programs that they oversee. And here's how Medicare works. Everybody pays taxes. There is a Medicare payroll tax that if you're employed, you pay a share, your employer pays a portion. If you're self-employed, you pay taxes toward the Medicare program, which then goes to the government. CMS controls those funds. It then goes to health plans and then beneficiaries. Now, if you currently have health insurance, you think of yourself as being the insured. In government programs, we're beneficiaries. So anytime you think about a Medicare beneficiary, that would be us. Medicare versus Medicaid. Medicare is health care. Medicaid belongs to those who need financial aid and who qualify. Under Medicaid, the Illinois Department of Health Care and Family Services is a state agency that administers Medicaid for Illinois. You have to get Medicaid only by applying to a local office. It can't be done online. The only pathway to get Medicaid is if you're signing up for a regular Obamacare policy and it's deemed under that process that you're eligible or may be eligible for Medicaid. Your information at enrollment under the Medicare.gov portals or healthcare.gov portals get routed to Illinois. And you're supposed to be contacted by the Medicaid office. Here are the four parts of Medicare. Part A, hospital coverage. B, medical coverage, and that would be outpatient visits to the hospital, durable medical equipment. Part C are Medicare Advantage plans, and Part D, prescription drug coverages. Under hospital insurance, Part A, here are some examples: inpatient hospital, skilled nursing facility services, home health care, and hospice care. It's important to know, though, under inpatient hospital, if you're hospitalized, observation, where they hold you overnight for observation, is not covered under Medicare. For hospital benefits, coverage for 2017, days 1 through 60, if you're hospitalized inpatient, it's a $1,316 deductible for a benefit period. If you stay beyond 60 days, days 61 through 90 is a $329 per day deductible. Days 91 through 150, $658 per day. And beyond that, it's 100% out of your own pocket. Are there any questions on that? Yes.
Are those days in a row, or are you talking about it within a year's time?
It's a benefit period, and the benefit period is when you first are inpatient in the hospital, continuing on if you needed to go to the skilled nursing facility.
And only until you're discharged, and there's a 60-day period after that, does a new benefit period begin. So if it's less than 60 days, you're in the same benefit period. If you have to be re-hospitalized 2 weeks later, or any time within that 60 days, it's that same benefit period, so all the deductibles would apply.
You mean like if you had to go back in the hospital 2 weeks later, you'd pay $1,316 again?
No.
It would all be covered?
Yes. You might be at the 20th day. Skilled nursing facility has different deductibles, which we'll see. But the benefit period is when you've actually been discharged from either facility. You have this 60 days in between. If you go in the 61st day, that would be a new benefit period. Does that make sense?
Okay. Part B is outpatient medical coverage, and here's some examples of covered services. Doctor services, supplies, diagnostic tests, outpatient therapy, outpatient mental health, some preventative services, emergency services, and ambulance services. That's under Part B. So your medical benefits for Part B, Medicare pays 80%, you pay 20%. There is a monthly premium, and this year, 2017, the annual deductible was $183. Last year it was $166. Now, for those of us who have employer-based coverage or individual coverage, you'll note that $183 is a very low deductible. However, the 20% has no cap. It can go on forever. So while we have individual coverage or employer-based coverage that does have a maximum out-of-pocket, Medicare Part B has none. So here's the new premiums. Starting in 2017, for those first eligible for Medicare Part B, it will be $134 a month. Last year, for those newly eligible, age 65 Medicare, it was $121.80. And prior to that, it would have been $104.90, and it stayed there a long, long time until 2016 and 2017. Now, here the slide says the premiums are deducted from the Social Security checks. Actually, when you're first age 65, you do have an option, and your option is if you want to wait until your full Medicare eligible age, which for most of us are age 67, okay? Medicare will actually bill you, and you can pay monthly, quarterly out of your paycheck. You can pay direct deposit. You can actually pay by credit card. Once you take full benefits under Social Security, then your Part B premium will always be deducted out of your Social Security check. There is no option on that. Under the state medical program, you pay premiums for those who meet income and asset guidelines. Medicaid would step in and pay for a portion, if not all, of your Medicare Part B. IRMA. IRMA is the income-related monthly adjustment amount for those high-income earners. And you can see by the chart that there's going to be a creep in the amount of premiums that you're going to be paying for Part B. So if you're single and you make $85,000 or less, you're going to be paying the prevailing premium. If you are married, joint return, $170,000 or less, you will pay the normal Part B premium. But then it starts scaling up. So high income earners are going to be adjusted to pay Part B at a higher rate. And the more money you make, the more you pay. I'm sorry, did I miss a slide? There is? May I? Okay. If you don't enroll in Part B when you're supposed to, and that's at age 65, if you don't have employer-based coverage or other creditable coverage, there's going to be a 10% penalty for every year that you don't enroll in Part B. We'll actually talk about enrollment periods, okay? There is an open enrollment period, but we'll also talk about that. And if you miss your normal initial enrollment period, there's a special enrollment period every year between January 1st and March 31st. Okay. If I miss another slide, let me know, hon. Okay. Any questions on IRMA? Okay. So there's a way to cover all the deductibles that we talked about and the 20% and limit your exposure. And most of us have Medicare supplement coverages. They're also called Medigap coverages. They're widely available, and before the introduction of all the other programs, insurance companies offered Medicare supplement plans. There was a lot of confusion and a lot of abuse in Medicare supplement marketing, the complexity of the plan. So the government actually standardized Medicare supplement plans so people could understand. So it doesn't matter if you choose a Plan F with United Healthcare or a Plan F with Blue Cross, it's exactly the same benefits. The premiums may be different, but the benefits must be the same. Medicare Advantage plans, Part C. The Part B premium that you actually pay to the government goes to a Medicare Advantage company if during open enrollment, which occurs between October 15th and December 7th of every year, if you decide that you'd like to try a Medicare Advantage plan, your Part B premium that you pay actually goes to the insurance company that you enrolled in. Now, Medicare Advantage plans are fairly recent. The companies offer not only vision coverage, dental coverage, some of them offer hearing coverages, but they compete with each other for your business. And on average, and it depends on what county you're in, what state you're in, the insurance companies per enrollee receive somewhere between $14,000 and $15,000 per enrollee. So if you enroll in a Medicare Advantage plan, not only are you getting or they getting the Part B premium from the government that you're paying and will continue to pay, they're also getting from the government roughly $14,000 to $15,000 per person. Now, That sounds like way more that you're going to use at age 65, age 66, age 67, right? But that doesn't change for the enrollee who's 95. Okay? So, depending on the experience of the insurance company and the actuarial statistics of the particular county in which the insurance company offers a Medicare Advantage plan, all this money goes to them, and the insurance companies have to actually insure everybody upon request, no pre-existing conditions, if that makes sense. Okay? It is strictly under CMS guidelines. 87% of the premium dollars from your Part B and the additional subsidies from the government are used in claims. The other goes to administrative expenses. Any questions yet on Part C? We're going to have more questions on Medicare Advantage plans. Okay, so in theory, Medicare Advantage plans are supposed to keep you healthy. They take the risk. So with that $14,000+ plus your Part B premium, they're supposed to manage all of your health. Medicare Advantage plans must pay, at a minimum, everything that original Medicare A and B paid. Most of them pay more. They'll include vision care, as I said, dental benefits. One major company actually bought a hearing aid company, and they offer hearing aid benefits. Fitness, silver sneakers, gym memberships, etc. Discounts on herbal medicines, chiropractic, acupuncture. There's a variety of them. But the caution on Medicare Advantage plans is that you've got to read everything that is covered. Now, as I said before, Medicare Advantage plans covers hospitalization, all your outpatient, all your durable medical supply, crutches, wheelchairs, and in 90% of the cases, they also include your Part D drug plans. So, here in Cook County, virtually every Medicare Advantage plan offers a drug card as well. The drug benefits are included in the plan, so there's no need to buy a Part D program. Beneficiaries will never lose their original Medicare rights simply by joining a Medicare Advantage plan. There's a way to join, try it out, and if you try it out, don't like it, by February 15th of the following year, you can disenroll and go right back to original Medicare A and B. You could at that time get your Part D drug plan and a Medicare supplement. So there's always a way to enroll in a Medicare Advantage plan and also disenroll, and that's your right. Yes, Carol.
My understanding is that most of the Medicare Advantage plans are very similar to HMOs in that you have to be in a particular network. Are there any Medicare Advantage plans that don't require you to choose a network, or are they all kind of in that HMO model of you've got to be in the network or otherwise you can't go out?
They're all PPO or HMOs. If you remember...
So some are PPO?
Yeah, some are PPO. There are quite a few PPOs in the Cook County area, Lake, DuPage County, the greater metropolitan area. If you remember that they're getting a fixed dollar amount for every enrollee, the insurance company has to manage their risk. And by doing that, they have to control their costs. I'm not defending the insurance company. This is the way the pricing works. Okay. They also take the risk of the fact that the 90-year-old who needs frequent medications and frequent hospitalizations, they have to get by with the same $14,000 a year. So they're all going to be managed care, smaller networks. And Medicare supplement plans, Medigap plans, you could virtually go anywhere. In our area, you wouldn't have a problem going to any hospital, in fact.
So you don't need a Medicare if you have Part C, if you have Medicare Advantage, you don't need a Medicare policy.
You can't actually have one, it's illegal.
Right, because it's kind of all encompassing, right?
That's correct.
And that 14,000 per person per year, that never, you said it never escalates with age. The amount never increases as you get older.
Correct.
But so it's a continuing 14,000 a year.
Well, that $14,000 is a range of what Medicare Advantage plans actually receive from the government.
Right.
On top of the Part B.
Right, and that's the part that they have to manage.
They have to manage. So if you think about it, they really can't ask you any medical questions. They can't screen out by age. The risk is on them.
So if they have to manage their own risk, out of that 14,000 a year, can they deny paying for a procedure or a doctor's visit saying it's unnecessary?
If you're an HMO and you're out of network, they can deny it. Otherwise, if it were Medicare eligible, and if you had original
Right.
Medicare,
Right.
they have to pay it. So let's assume you're always in network. I think that's where you're going with it, right?
Yeah,
Okay, all plans have to pay at least what Medicare A and B would have paid.
Okay.
Okay, now, remember A and B would have paid a lot less if you didn't have a Medicare supplement. Or they paid an amount
right.
less your $1,300 deductible for the first 60 days, right? So what you'll see is a lot of Medicare Advantage plans, they have to pay what A and B pays, but not what A and B in a supplement would have paid. So typically, you could see out-of-pocket costs if you go to the hospital. You'll see a $250 per day copay to go to the doctor. So you really need to look at a Medicare Advantage plan and try to peer into your health crystal ball and see what kind of expenses you're going to have. That's no different if you had a corporate plan and you were looking at 5 different plans to enroll in, and you had a flexible spending account or a health savings account. You have to kind of make those predictions at open enrollment time. It's the same with Medicare Advantage, with the fallback that you can disenroll February 15th. Yes.
So, just so that I can understand, so I have a choice of having Part A, Part B, Part D, and supplemental, and with under that rubric, I would be paying my premiums directly to the government, correct?
Well,
I'm paying premiums like that $134.
yeah, the 134 would go straight.
Just for the B.
Yes,
not counting D.
correct.
Or, my other option is to enroll in an Advantage, a Medicare Advantage plan,
Mhm.
and is one better than the other? Or like I'm just gonna have to weigh like what the pricing is against both of those?
You would, because if you take an HMO, at least in the metropolitan area, you can find a lot of Advantage plans that include a drug plan for 0 premium. When they say 0 premium, they mean you paid your $134, and there's no additional premium for you. Now, if you're 65, 66, if you take A and B and you say, I need a Medicare supplement, it's going to cost you roughly $140 per month. So people on limited income or people who are perfectly healthy might say, well, I'm on no meds, I hardly ever see a doctor, I'll save the $140. Because I have to pay the $134 in the Medicare Part B, right? Like, I'm going to pay that anyway. So I'll join a Medicare Advantage plan that is 0 premium, meaning I'm not going to pay any more than the $134. Okay. So the Medicare Advantage plans, the HMOs, would charge you typically no additional than what you pay Part B. But if you want more freedom in that Medicare Advantage plan to go to a PPO, or you want more benefits like dental and vision in this other Medicare Advantage plan, you may be charged $70 or more for the PPO Medicare Advantage plan, and you're still paying the $134.
So then that kind of explains when you were saying that all insurance companies have to offer the same benefits, but the premiums may differ. That's what you're talking about, like, oh, I could get dental in there, so that's why my premium might be higher with one insurance company over another.
All the insurance companies must offer at least the equivalent of A and B.
Okay.
Okay.
So your higher premium comes out of the fact that you get some extra.
That's right.
Okay.
You could be a real smart shopper, and if you're hearing impaired and you find that insurance company that pays that full hearing aid, what is it, $2,000 to $3,000 for hearing aids now? That's a significant cost that you could avoid by just taking this other Medicare Advantage plan. By the way, this is educational. I'm forbidden to name any insurance companies for Medicare Advantage plans. Okay? So all I'll be telling you is major insurance companies in the metropolitan area. I can discuss Medicare supplement plans, but not Medicare Advantage plans or Part B plans.
So, is it, you pick either Part B or Part C? Is that what you're saying with
Lynn, that's essentially right, as long as you understand your Part B is going to be covered under your Medicare Advantage. Part B, if you think about it, and Part A and B together, is comprehensive major medical. Inpatient hospital, outpatient doctor's visits, durable medical supplies. When you subscribe and enroll in a Medicare Advantage plan, they're actually your A and B provider. And in 90% of the cases, D. I'm sorry? They vary from company to company.
So in Cook County, for example, how many Part C carriers are there?
I tried to send an email earlier. I don't even know if I have internet access, but roughly a dozen. Okay. There's a pretty good representation, and what we wanted to do was sample Part D to show you how it looks on the internet and how to search on the internet. Let's hope the internet is working on that. Okay.
So even though you're not allowed to say anything about specific companies, do you have knowledge of them?
I do. In fact, all brokers and agents who talk to you about any Medicare Advantage plans has to go through an annual exam, be federally certified. We also can't solicit. I can't send you an email and say, hey, you have to actually come to the agent or broker and request an appointment.
So in a private conversation, I could ask you.
Yes. And all the materials have to be vetted by CMS too.
Thank you, Gary.
Yeah.
Okay, so if the insurance companies that sell part, the Medicare Advantage programs are determined by county, what if you live in DuPage County and you purchase whatever is available to you there, and then you move into Cook County and then the benefits or the carriers are different? Or are they pretty much overlapping?
If you're going from DuPage County to Cook County, you're not going to have to change. If you go to northern Indiana, probably. If you go to Cleveland or San Francisco, you'll always have a new open enrollment, a new enrollment period.
Okay, so if you leave the
Right.
basic geographic area where you would initially enroll,
Right.
you go out of state, say, then you have to, open enrollment, you have to readjust it.
Right. Exactly.
Okay.
Mentioning DuPage County, I had a client who had Medicare supplement and Part D. And we were doing some financial planning. And all of his care was at Central DuPage. So if you're contemplating a Medicare Advantage plan, you need to go and search the providers, because that's the deal maker. It just turned out that everyone, and that's his primary and 4 specialists, were all at Central DuPage and all part of this Medicare Advantage plan. So that was a no-brainer. And you don't feel bad about that because it was a perfect fit. But, you know, I don't usually see the perfect fit. You still need to search. And you might have to give up one doctor. And some people may be okay with that. They may be fine having Advocate do all their care, where one of their doctors were at Northwestern. They may want to give up that one doctor.
But likewise, if you just stay with traditional A and B, you still need to check with your doctors to make sure that they're still Medicare physicians.
Well, when they say participating
Yeah.
physicians, they simply, under Medicare terminology, that means they simply accept assignment directly from Medicare.
Right, but there are more and more doctors that are dropping out of Medicare.
There is that. The other thing is that if you're an occasional physician user and the sign-up list for the first 100 patients that they'll take care of under Medicare comes out in the fall, and your annual exam was in the summer, you don't even know there's a list to sign up. So you need to check with your doctor to find out if they're going to limit the number of Medicare patients they'll see. But I see that less and less, because as you know, the trend is that the doctors are actually signing contracts with the hospitals. And the hospitals are really the drivers of these practices anymore. Now, the young physicians don't really want to work by themselves and hang up their own shingle. They want a life, so most of them are contracting with hospitals. You won't have that problem normally in this area. Okay, anything else?
Okay, we already talked about silver sneakers, gym membership wise. There are a host of other things that Medicare Advantage plans will offer you over just your Medicare supplement plan. But remember, you're giving up choice. You're accepting a narrow network. But for those of us who come from employer-based plans that are already PPO and HMO, many people now going to qualify at age 65 for Medicare benefits, they say, well, that's the same network I have under my employer plan. I'm okay with that. So in the Chicago metropolitan area, there's 15% penetration of Medicare Advantage plans, 15% enrollment. Nationwide is 30%. We're the flip of the rest of the nation. And to be honest, and that's really because Blue Cross and Blue Shield of Illinois was late in the Medicare Advantage plan. They developed their plans only 3-4 years ago. We already talked about 87 cents of dollars paid to Medicare Advantage plans go to claims and benefits to you. Part D prescription drugs. How are we running here? Okay, how many of you have Part D prescription drug plans? Okay. How many of you are just about to go on Medicare? Okay. It's about half and half. If you've decided you want the full choice of the Medicare supplement, you'll need to get a Part D plan, because if you don't get a Part D plan when you're supposed to, the penalty is 1%, it's on one of the other slides, per month that you should have had a prescription drug plan. And that's no different than what you've been reading about the Obamacare policies. Everybody has to have it because you need the healthy people in to offset the sickness on all the claims on the unhealthy people. That's no different from Part D plans. You may say, I don't take any medications, but you still have to have a Part D plan. There's also a penalty if you make too much money for the Part D as well. So if you have a separate Part D plan, there's going to be an upcharge and they're the same tax brackets. If this applies to any of you, you already have those letters saying, hey, you're going to pay more under the IRMA, but when you first qualify for age 65 benefits, there's a look back. So let's say that you retired at age 65 and you know you're going to wait another year until age 66 to take your full Social Security. You think it's going to be $134 this year, but it could be a lot more because you've just retired. There's going to be a look back. So the only information that they will have is your latest tax return. And at this point in time, it would be 2015. So you retire in June, and by the time they find your 2016 tax return in August, you might get a letter saying, hey, we're going to back charge you all this money because you made more money. Yet you're fully retired. So that could happen, and that happens quite a bit. The Part D late enrollment period is on the slide. It's 1% per month that you delay your enrollment. But if you think about it, that 1% is not a lot. If you take an average drug plan in this area, let's say $30. 1% is 30 cents, right? If you go a whole year, let's say you go 10 months, make it easy on me, it's $3. So now you're going to be paying $33 a month. And you're thinking, well, you know, that's not really a big deal. I'll wait a couple years. I'll pay the upcharge because if I'm paying $30 a month, I'm making my money back. All you need to do is get prescribed a brand name drug during that year, and anything you would have saved is gone. So that's really the bigger penalty. I try to take very good care of the client who says, I'm on nothing. So what we try to do is make sure we give them the lowest price plan, and you can, in Cook County, you can get one for about $17 or less. And you can avoid the penalty going forward. Okay, coverage gap. For those of you who are on a lot of medications, you already know what the gap is. By 2023, I believe the gap is supposed to disappear altogether. But Part D plans require cost sharing from both you and the insurance company. So you're going to have co-pays like you have under regular insurance. Under Part D plans, when you go on Medicare.gov and do a search, you can put in every drug that you take, and it actually searches the formulary for the best price and the recommended plan for you. But we're not going to cover that right now. Okay, if you're low income, there's what they call the LIS, the low income subsidy, and this program lowers the cost of your Medicare prescription drug coverage. So if you are on a lot of medications and you just happen to know that there's a $60 per month drug plan that is best for you, if you're Medicare eligible or you're low income eligible, you might get a 50% discount on that $60 and pay $30, or you actually might get that Part D plan free of charge. To qualify for the low income subsidy, you have to be on Medicare, you have to have limited resources, and you have to have limited income. Let's go over the enrollment. These are the periods under Medicare Advantage and Part D, prescription drug plans, that are annual. So the first one is when you first turn age 65. And let me see if I could get something that looks a little bit better here. Let's go to the next slide. Okay, so your initial coverage enrollment period. This is the person who turned 65 in June. and during the month of June, not June 1st. So your period of enrollment is 3 months before June and 3 months after June, and during the month of June as well. So you get 7 months to actually activate your Part B coverage. You can enroll in Part D, you can enroll in Advantage plans, but you have to have Part B activated before you can have a Medicare Advantage plan or a Part D plan. If that makes sense? Okay. So if you do the enrollment online and you start at the Social Security website and you indicate that you want to activate Parts A and B, if you activate Part B, your coverage would start June the 1st if your birth date is in June. If your birth date is June 1st, it would begin May 1st. Okay, so who here is going to be 65 this year? I know, Carol. Okay, so you really do want to do it earlier than later, because if you actually do it in June, your Part B will not start until July the 1st. But there's always a paperwork hurdle as well. Okay, so it may not be activated actually until August 1st. So I always try to encourage people to start earlier than later. Okay, any questions on this? This is your initial enrollment period. Okay.
I have a question.
Yes.
That is, if you're currently employed and you have insurance through your employer, so consequently, the only thing you have to sign up for is A, you don't have to sign up for B and D because you've got coverage. If you were to lose your job, are you still going to encounter that 1 or 2 month delay before you would be able to get insured through Part B and D of Medicare?
You may, because when you go to the Social Security office, they have to determine whether or not they're going to penalize you for not having Part B when you're age 65.
I thought you only had to have Part A when you were 65, and you don't have to have Part B if you're insured.
That is correct. So they're going to ask you for this form. And this form is signed off by your employer. And then it goes back to Social Security. So when I know that that person is coming off the group insurance, I give them the form in advance. Otherwise, they're going to the Social Security office and they're getting the form. That saves a little headache. You are not required to have Part B if your employer has 20 or more employees. If it's under 20 employees, you're still probably going to need Part B.
But if you've met all the legalities, you're still running a risk. You're running into the possibility that if you were to lose your job and you didn't pick up a COBRA coverage, that you could potentially have to wait a month or two to be insured for those components that are covered under Part B and D.
Absolutely right. Here's the thing you've got to remember. COBRA does not exempt you or forestall the penalty. So some people retire and they take COBRA when they don't know that Medicare is going to count that.
I get that part of it. I'm just wondering if you could have a small portion of your life where you're not fully insured.
It's possible, but if you're careful.
Well, if you're fired and all of a sudden you're out of a job,
And
it's not something you can plan for.
But you do have the right to COBRA, and even small groups.
That's what I'm, that's,
Yeah.
okay. All right.
Okay. You have that COBRA right.
Thank you.
Okay, this makes sense.
All right, so here was your question here. You've lost your job. You're moving onto another service area, you get a special enrollment. So you sign up for a Medicare Advantage plan or a Part D, and you've got a supplement. And you move to Florida. That's a special enrollment period because it's clearly out of the service area. Now, we actually know someone who moved from Chicago to California and kept the same drug plan and was told you have to re-enroll. Even though it's the same drug plan, same company, they're sold in different states. And this person had to immediately re-enroll and get the same drug plan, same insurance company, but essentially it was a California plan versus an Illinois plan. Okay. Obviously, you can gain or lose Medicaid eligibility. qualifying for extra help for prescription drug coverage, that's the low-income subsidy. Terminating current plan, turning 65 while already on Medicare disability. Okay, here's your annual enrollment period. And your annual enrollment period affects all Medicare beneficiaries who already have Part B or are going to be on Part B. October 15th to December 7th, you can change your drug plan. You can enroll into Medicare Advantage plan. You can come out of your Medicare Advantage plan and take a Medicare Supplement plan, all effective for January 1st of the following year. Now, let's say that you actually choose a Medicare Advantage plan in September when you're first qualified. You can actually change the very following January 1st to a different Medicare Advantage plan, or take a Medicare Supplement. Let's say that you're searching for a Part D plan and you sign up right away October 15th and you choose your plan for 2018, and you go to the doctor in November and he prescribes you a prescription and it's going to be long term. And you're thinking, I searched this Medicare.gov website, I chose my Part D plan, I'm going to recheck this and find out if this is still going to be the best plan in 2018. The last Part D plan or the last Medicare Advantage plan that is received by December 31st will be the plan you'll have in 2018. You could do it 10 times if you wanted to. It's the very last plan that's effective. Does that make sense? You don't have to enroll, disenroll, call the insurance company. It is all pretty seamless. Okay, disenrollment period, January 1st to February 14th. Medicare Advantage customers may disenroll. You don't like it, or the doctor that you thought you were going to get retired, or you just change your mind. You can disenroll. You have to call Medicare directly, and they have a toll-free number to do that. That's the only way you can disenroll. Can't call the insurance company, can't call your agent. Doesn't work. Between December 8th and October 14th, Medicare beneficiaries are locked into your choice of a Medicare Advantage plan unless you have a special election circumstance. For the exception of that disenrollment period, if you miss that February 14th cutoff date, you're committed to the plan, whether it be a Part D drug plan or whether it be a Medicare Advantage plan. Any questions on that? Okay, so let's summarize. The original Medicare pays 80%. You're the beneficiary, you pay 20%. There is no limit on that 20%, and that's why most people purchase either a Medicare Advantage plan or a Medicare Supplement plan. Part A, per occurrence, per benefit period, deductible is $1,316 for 2017. Part A enrollment is automatic for most. You need to proactively enroll in Part B either through the Social Security website or going to the Social Security office. This year, Part B has a deductible of $183 and a premium of $134. You should add, and it is recommended to add a Part D plan, and with that, you have no networks. Medigaps, also known as Medicare Supplements, covers the 20%. There are no network restrictions. It's portable from locale to locale. As long as the insurance company is working in another state, you may keep it. You have to have Part A and Part B. You should have a prescription drug plan, Part D. Your premiums are likely to increase every year, and when we have the chart, you'll see every age is a different premium. There could be medical underwriting. In Illinois, and this is Medicare supplement, Blue Cross does not have any medical underwriting. So if you start with Blue Cross and you have a pre-existing that develops during this time and you want to switch to United Healthcare or Mutual of Omaha, they could screen you. On the other hand, if you have Mutual of Omaha and you don't like the rates but you have a pre-existing, Blue Cross will take you. So it works one way. There are no bills for Medicare approved expenses. For those of you who have Medicare supplements, go to the doctor, get your explanation of benefits form. Most of you have that last line item that says the amount you owe provider, 0. And that's because Medicare has paid their portion and the Medicare supplement insurance company has paid their 20%. Medicare Advantage plans, summarizing. They're private insurance companies competing for your business. They're network driven. The goal is best clinical outcomes to save them money. And that's why most of them will always outreach to you for preventative care. And if they know your diagnosis for a particular illness, they may reach out to you more frequently to make sure you're maintaining your drugs, maintaining your office visits. 90% of them include Part D. They have to include original Medicare or cover everything that Medicare would have covered. Your annual maximum out-of-pocket ranges from $2,900 to $6,700. Some of the HMO Medicare Advantage plans have no out-of-pocket as long as you're in network. And you could save significant amounts of money throughout retirement versus supplements. Now, supplements will go up every year in premium. Medicare Advantage plans typically are very moderate in terms of rate increase. But because Medicare is primarily the risk taker and covers the claims under Parts A and B, your Medicare supplement plans typically won't go up more than 4% a year. And normally you'll see either 1.7% rate increases, not to include your next age band. Okay, so here we're on the questions. Now, I added in your pack copies of articles called Medicare Mistakes. And that typically gives you all the cautions that you would need. For those of you who have AARP magazine, not the magazine, but the circular that comes out, that's from that. And every fall, you're going to have all these articles on Medicare issues. But if you look at that very last article, it urges you to always check your Part D plan every year because the formularies change from company to company and they change within the companies.
Right.
Yeah, Carrie, I have two questions. One you may not be able to answer. First question is, with all the reports on what the changes are probably going to occur, what changes are proposed for healthcare with the repeal of ACA, do you see any changes to Medicare and the insurance and the Advantage plans that insurance companies will provide that we should be looking forward to? That's my first question.
Okay.
The second question is, as a hypothetical, for your average person in their maybe 60s,